Hello, everybody. You're welcome to, okay, nobody's here yet. I have to wait for at least to see that people are here before I start. Nobody's here yet. Unless people are watching without texting. Welcome, Mr. Fandu. I'm here. Wonderful host. Thank you for coming. My own darling husband. So, oh, hello, my own dear sister, Maka. Professor Maka Ukeke, you're welcome to this live stream. Rawan, you're welcome, Rawan. Thank you for coming. Thank you for coming, Rawan Hazy. X. Rawan? Yeah. Okay, so you know what? We're just gonna start. We're gonna start right away. And people can just join the chat as we come in. You're all welcome to this live stream today. And my name is Chinwe Yufandu. And this is UNMASCLifestyle. If you are coming to this channel for the first time and you like what we do, I would suggest that you please go to the channel after this live stream and watch a full video and then try to connect with us. You can push your notification bell so that you would have the privilege to get any of the videos as soon as we upload them. This is a purely live, healthy lifestyle channel. I'm sure anyone who connects with this channel will benefit with it. So today we have a special guest speaker that will be talking to us regarding breast cancer awareness. Elizabeth Nwosu, you are welcome. Mr. and Mrs. Anibello, you're welcome to this live stream. Thank you for coming. Toko Sang, you are so welcome. Really appreciate your presence here. Thank you all for coming. Thank you. So today we have a special guest from John Hopkins Healthcare, and she will be talking to us about breast cancer because this is October. So, and I'm not going to waste time, but invite our special guest to the live stream. Hello. So, you're welcome to the live stream, Doctor. So before, I'm just going to give a little brief information about our guest today. So she is nobody else but Dr. Mrs. Jacinta Ukah-Ogbona, DN, MSN, RN. And I must say that Dr. Mrs. Jacinta Ogbona is not just an academician, but a very committed community builder as well. So Dr. Mrs. Jacinta Ukah-Ogbona earned her Doctor of Nursing practice from Johns Hopkins University, Baltimore, USA. She is a nurse executive with over 31 years of experience in both inpatient and outpatient nursing. As a nurse clinician, nurse administrator, and nursing director in academic and teaching hospitals in New Jersey, USA, and the Kingdom of Saudi Arabia. Dr. Mrs. Jacinta Ukah-Ogbona, you are welcome to this live stream to discuss breast cancer awareness. So,
thank you so much, Mrs. Chinwofondo, for inviting me to your Vibrant Lifestyle channel. And I'm here really, really very grateful to share this conversation with all of you, because health is wealth. And I just want to begin by giving everyone a disclaimer that I am not representing any entity, and there are no financial incentive for what I'm doing. This is a health conversation to prevent disease. So please, as I ask you to relax and enjoy the conversation, and at the end of this conversation, I would love to answer a lot of your questions. So please begin.
Thank you so much, Doctor. I'm so flattered that you came to this channel to talk to my audience today. And really, really appreciate the wealth of knowledge that you bring to us with your many years of expertise and experience. 31 years is not like 3 years. It's 31 years from one of the best universities and health, hospital in this planet, Johns Hopkins. So I am really honored to have you in this channel today. So the first question, which I'm sure my audience would like to hear from you, would be if you could give us an overview of breast cancer awareness and why it's in the month of October.
Thank you so much. Breast cancer awareness is marked all over the world from October 1 to 31. And of course, it's an international campaign organized by many organizations and charity organizations, including institutions, to help to increase the awareness of the disease, to raise funds for research, and also to talk about the causes, the prevention, diagnosis, and treatment, and cure of breast cancer. The campaign also offers information and support to those affected by breast cancer. Of course, pink ribbon is the prominent symbol. Of course, if it's not even only a pink ribbon, it's your shirt, your t-shirt, it's a prominent symbol for breast cancer awareness. So go pink. So I'm going to encourage you to really rock your pink if you have it on, just to really celebrate this important health disease that we are going to really try to prevent. Thank you.
Thank you, Doctor. So my next question will be, what is breast cancer?
Well, it is important to also understand that talking about breast cancer awareness, it's important to talk about what is breast cancer? The first thing I'm going to tell you is breast cancer is a cancer that really starts from the breast. And it starts from tissues that grow out of control. And they can form a lump or a tumor. And breast cancer can usually be seen on an X-ray or by you feeling it when you do your own breast examination. And most breast cancers are due to breast tissues that are aging. And we're going to really go into that as we continue. It is very, very important to understand that most breast cancers are benign. Not all breast cancer is malignant. So therefore, the non-cancerous or breast cancers or breast cancer or breast tissues that do not, or breast overgrowth that does not cause cancer, do not actually spread. They stay in the breast tissue and do not spread. Those ones that do not spread are also not life-threatening. So therefore, and also really breast cancer is not a death sentence. So we're going to really be talking about that. And as we go on, you'll probably understand why I say that it's not a death sentence.
Wow. Thank you. That's very encouraging. You know, when we hear cancer, it's like we're dead even before it gets to us. Thank you for encouraging us with that. I'm sure the audience would like to know what's the causes of breast cancer. What are the causes?
It is important to know that one of the most important things that is really it's tough is that sometimes we do not understand or know the reasons for breast cancer. And also some of the causes are also uncontrollable factors. But breast cancer usually occur almost entirely in women over the age of 60, but can also occur in men. Men too do get breast cancer. Breast cancer can also occur in women in their less than 60, in very, very young age. And what are the reasons? What are the causes for breast cancer? There are so many of them. And let us begin with lifestyle. And that's probably why your channel is about lifestyle. About use of alcohol, smoking, obesity or overweight, people that have history of breast cancer, or people that have genetic diseases, maybe inherited genes. For this, for the people that have inherited genes, it's about 10% of the population of people that will get it if you have family history of breast cancer. Also, if you have a family history of breast cancer, or you have already had breast cancer in one breast, you have the high likelihood of getting it in the other breast. Also, there are also environmental factors like exposure to radiation, hormonal changes. Hormones may be for, especially in the changes in estrogen for young girls that started their period before the age of 12, or older women that actually are older, or people that have gone into what we call menopause. They do not see their periods anymore. Becoming pregnant in an early age, in an older age, or people that never became pregnant, and or people that have used hormones, long time use of contraceptives and hormone replacement therapy. And we should be able to talk about all these causes and risk factors as we progress. So go ahead with your next question.
Wow. Doctor, I am so glad to have you here to educate this honorable audience. So my next question would be, if you could talk about statistics, breast cancer statistics and worldview, Saudi Arabia, USA, or what have you?
Well, I have a lot of statistics to share, but I'm going to begin with the world. So, of course, from what I can share with you, that breast cancer is the most frequent cancer among women. About 2.1 million women are impacted each year. This is according to the literature in WHO. And some of the people in 2018, it was estimated that about 627,000 women died from breast cancer, approximately 15% of all cancers among women. And breast cancer rates are higher among women in developing regions or in developing countries. The incidence of breast cancer is actually increasing in every region globally and even in the developing world because of increase in life expectancy, increase in urbanization, and adaptation of Western lifestyle. And of course, most of the statistics are coming from developed world, but looking into WHO, there is also a lot of information regarding USA, Saudi Arabia, and I will continue to talk about what's going on. So, for example, in the US, 1 out of every woman will have breast cancer. About 12% of the population will have breast cancer over the course of their lifetime. In 2020, in the US, it is estimated that about 276 new cases of invasive cancer is expected. And along with that, about 48,000 new cases of non-invasive cancer will occur in 2020. And new cases continue to develop every year. And even in men, about 1 in 800 men will get breast cancer.
Mm.
And Chinwe, it's important to talk about, when you talk about the US, we talk about race and ethnicity. For African American women, which is people from African descent, Black people, their women under the age of 45 have the chances of getting more cancer than their white counterparts. And overall, African American women are more likely to die from breast cancer than Asians and Native Americans. But although all these people, women are at risk, but because of health disparities, there are so many disadvantages for the Black race. So I'll talk about the statistics in Saudi Arabia. Since we live in this great country, so it's important to really understand what goes on. And this is about from the National Council of Healthcare Information Center and the Saudi Cancer Registry in 2015. And they're saying that breast cancer also ranks among the first, among females in Saudi Arabia. Between January to December 2015, about 60%, 16.7% of women in Saudi Arabia have breast cancer.
Oh my goodness, a lot of numbers.
But in Saudi Arabia, we also have different regions. And just to give you an example of what is going on, we live in the Eastern region. And of course, in the Eastern region, which is the Dammam, Koba area, about 37 out of every 100,000 women who has breast cancer. In the Riyadh region, 33 out of 100,000. In Mecca, it's about 26 out of 100,000. And then the median age of getting breast cancer in Saudi Arabia is 50 years. And of course, Saudi is a huge place. It's about, maybe with the experts, it's about 32 million people. But 16.7% among all cancers. But for women in all ages, it's about 30% that have breast cancer. Talking about the incidence of breast cancer in the UK, it's almost that of the US. About 15% of all new cancers in 2017 and really from in the UK. And also 17% of cancers between the ages for women under 50 years of age. 24% occur in women over 75%. And UK is saying since 1993, there has been an increase of about 23% of breast cancer rate since 1993 to 2017 in the United Kingdom. And since both of us are Nigerians, of course, we live abroad, but it's important to see what is going on in Nigeria. So I was trying to see the statistics of what is happening in Nigeria. And just to let you know that from the statistics I have about 2018, based on the WHO data published in the World Health Rankings, breast cancer death in Nigeria has reached about 16,000. And also, about 32 out of every 100 women in Nigeria is prone to having breast cancer. There are so many issues about health disparities in Nigeria because there are absences of screening, of course, poverty, poor treatment, and poor access to medical care. And these are some of the reasons why and the incidence of breast cancer is high. And I can tell you, based on this data published by WHO, it's saying that Nigeria ranked number 4 in the higher rate of breast cancer deaths in the world, about 32 out of every 100 person. The adjusted death rate is about 32 per 100,000, which is huge. And that ranks number 4.
Oh my goodness. Wow. Fantastic. Wow. This is lots of information. Like we have to digest all of these statistics. Oh my goodness, really appreciate all of this information on behalf of all the wonderful audience that we have. The next question would be, I know somebody has a question, but we're just going to run through all of the questions that I have for the doctor today. And then if any of the questions that we have is not covered, then we're going to get through it. Okay, everybody? So my next question would be, what are the signs and symptoms of breast cancer?
Well, one of the things I will talk to you about is, remember when we were talking about the overgrowth of the breast tissues?
Mm-hmm.
One of the biggest symptoms is a lump or swelling in the breast that feels a little lumpy around the surrounding tissues of the breast, especially in the chest, in the upper arm. And usually you will see the changes in your skin, some puckering, some dimpling, and changing the breast color, sometimes resembling orange peel, or the breast becomes red or inflamed. The nipple can change or become inverted or pulled in. There can be rashes. There can be crossing around the nipple, and sometimes an unusual discharge that is not milk, it's not breast milk. And also there may be changes in size, shape, and appearance of the breast. But usually women will begin to feel a lump when they do their self-exam, and that's usually one of the first signs. Or pain. Breast cancer is not supposed to be painful, but the pain that is in the breast or under your armpit or by the armpit that has been there for a long time and persistent, those are some of the signs of breast cancer.
Wow. I know we have questions, but like I'm saying, I would like us to go through all of the questions that I have for our honorable doctor today before we get into all of these other questions. Because she might not be able to do all of these questions. We're just going to address a few. But if later she will be in this chat, if you have questions, you can go back to this video and watch it. Drop your questions. She will be very glad to answer any questions you may have, even after this live stream. So, Honorable Dr. Jacinta, my next question would be, what can we do to help ourselves, like in terms of self-care?
So definitely for self-care and risk reduction, it is very, very important to take control of your own health. The best doctor you have is you. It is very, very important to have understanding of your own family, medical history, your own personal history, and early detection is the cornerstone of breast cancer control. It is advisable to start your own self-breast examination as early as the age of 20. Best time to do the breast self-examination is really to feel your breast, to do your breast examination when the breast is not tender, when the breast is not swollen, usually on the 10th day after your first menstrual period. And for women who do not have their menses anymore, who have gone into menopause, or women that have hysterectomy, they do no longer have uterus, you can pick what time of the month you choose, but make sure that that time you have chosen becomes a routine for you. It's very, very important to eat healthy and nutritious food. And I can tell you, because personally I love food, so I think it's important for me to ask you to look at the healthy diet. And usually with the help of the nutritionist, to really look at the healthy diet for you that is good, that will also help you prevent, not only for breast cancer, but for all other diseases. Limit and avoid alcohol. Too much of everything is bad, including drinking so much. So usually I'm not telling you to stop drinking, but at least if you're going to drink, you're recommended to have about 1 drink a day. Avoid smoking. There has been so many suggestions between the links between smoking and breast cancer, and particularly for younger women, those that are still in their premenopausal era, which is you're not up to 40, you're not up to 45 or 50. And breast cancer risk also lowers when you do moderate exercises. And of course, when women breastfeed, women who have who started having babies at a younger age, in their 20s, and also the reduction of use of hormone replacement therapy, because the reduction of exposure to hormone replacement therapy, especially estrogen, because I saw somebody saying what kind of birth control pills is recommended. When you take a lot of estrogen, of course, they are hormones, you are prone to having breast cancer. So usually, if you're going to use birth control pill, you should ask your doctor to give you maybe a combination of both progesterone and estrogen, instead of just giving you a medication that has only estrogen. The message about self-care is very, very important, to know how to check your own breast. And like I said, it's not only women that have breast cancer, including men. So therefore, it is important to have the ability to check your breast every time. You can check it while you are standing in the mirror, getting ready to take a shower, after shower, taking a warm bath. Anytime, stand in the mirror and check yourself. When you are checking for your breast, please do not go from the nipple and outside, from the inside to outside, including your collarbone, under your armpit, and under your chest. You're looking for lump. Usually you have to use the palm of your hand. And don't be afraid to really touch yourself to check if there are any kind of changes in the breast. You are the only one that knows your body. So that's why it is very, very good too. So when you're going to be checking, you're looking for knots, lumps, swellings, thickenings, and also try to squeeze gently, because remember, when you have discharges that are not breast milk, may be sign. So try. And please, I have a very simple mnemonic for you. Don't forget this word is called TLC. TLC means touch, look, and check. Mm-hmm. Touch your breast. Look at your breast for changes, size. Do not forget to check. When you are in doubt, please check with your medical doctor or your nurse practitioner. The body is yours, so looking makes it easy to know if your breast size has changed, if there are inflammation, if the color is there, or anything, or even inflammation, or even crustiness, dimpling of your nipples, or puckering of your nipples. So TLC is a word that I don't want anybody to forget. Both man and woman must have TLC, which is touch, look, and check for your own breast, so that you can be able to be your own advocate before anything else.
Wow. Oh my goodness. I am loving this. You are feeding us, actually. Knowledge is power. Today we know if we don't take anything away from here, let's remember TLC. We need that. Touch, look, and check. Thank you, Doctor. My next question for you would be, when would be the best time to start screening for breast cancer?
Yeah, remember I had said earlier that the best thing to do is to begin early as in your 20s. Begin to feel yourself. And early dictation is the best cure. You know, when we were growing up in Nigeria, they always say, prevention is better than cure, prevention is better than cure. So, of course, if you begin early to take care of yourself, you may be able to prevent and prevent death if you have to really begin to take good care of yourself as soon as possible. So there are screening for breast cancer helps in diagnosis of. So there you begin with physical one. The physical examination is what I talked to you about. The checking for lumps, hardness, tenderness, and in your breast, and also checking for lymph nodes. That's the physical one. And then there can also be blood counts or blood examination. Blood can be done from your doctor. He can order some blood tests for to see if there are any kind of abnormalities, to check for infection, and also to when all these physical things are done, there are other more things that can be called diagnostic tests. One of them is mammogram. Mammogram is an X-ray to check for lumps in the breast. It's a specialized X-ray. I really don't want people to be scared about mammogram. I had a girlfriend that once she was so scared to go for mammogram. Mammogram is a screening test, of course, and I've done it many times. It may be a little bit uncomfortable, but in the end, really, the end justifies the means. It's not that horrible. So it's important to go for mammogram. And I'll tell you what ages you can start that. You can also have what they call PET test, which is a position emission thermography that can determine the stages of cancer. So if you have already has a cancer already, you go for a PET scan to know what stage the cancer is. Ultrasound is an imaging that uses sound waves to detect abnormal lumps. And also MRI is a detailed imaging to check for breast lumps. And then if also maybe the doctor cannot find it, he will do what they call a breast biopsy, where he will take a piece of tissue and there will be he will then send it to pathology, and they will do a microscopic examination to really see what kind of cancer a person has. So physical examination, blood counting, a blood test, mammogram, PET scan, ultrasound, MRI, and biopsies are like some of the screenings that can be done for breast cancer. So I was talking about the early detection and why is it important to really begin early. Breast self-examination is actually the paramount test. If a woman checks her breast every month, it's easier. And there's recommendations as to when you can begin to do the mammogram based on the American Cancer Society. The recommendation is to start the annual mammogram at the age of 40. But I've known that people who probably are going through infertility in their 30s or even in their 20s, some of the doctors recommend that they do a mammogram. And we have had the possibility of women in their 30s, even in their 20s, having breast cancer. And then from the ages of 40 to 54, it's recommended that you have annual breast mammogram. From age 55 and older, you can then switch it to every other year, every 2 years. And you can continue that for 10 years or longer. So you begin with the first recommendation is a self-breast examination. And then you go from annual mammogram from age 40, unless you're going through maybe some other medical issues, infertility treatment that the doctor can recommend for you to do mammogram early. After the age of 54, you have to do it every other year. So those are the recommendations for screening.
Wow. Oh my goodness. I am so excited that you were sharing this knowledge with the honorable audience that we have. So just a little housekeeping, doctor, excuse me. So what I'm doing is, if I see any, you have to stay active in the chat so that I can see whatever. I can go back to the chat to see your question or your comments. So, but I'm going to make sure that I don't miss anybody in this chat. So if you have any question or anything that you put on the chat, you have to stay active so that I can arrest your chat and so that the doctor would also take a look at it. So that would help us all to stay, on top of all of it. So that being said, my next question to you, Dr. Jacinta, would be, what are the treatment options? What would those be?
Yeah, I just wanted, before I can see a friend of mine is Sunita had asked me a question.
Okay.
She says it's true that mammogram is very, very painful. The pain is not, it's really not that bad. So I really encourage women after the age of 40, ensure that you do a mammogram, whether you have history or not. It's just but so I guess when you do it once, you will know. The only way you find out is you check it out. And I've done it for many, many years. So I think it's the pain is bearable. So the treatment options are primarily based on the stage and the kind of cancer. The treatment options ranges from medication, which is a chemotherapy drugs, to reduce the size and prevent the spread or reoccurrence. And hormone therapy used to regulate the proliferation or the growth of the sensitive cancer cells to prevent the production of hormones and to reduce the action of the breast cancer. Then another treatment is surgery. In the surgical part, there are about 3 types of surgery done. One of them is a lumpectomy, where the surrounding tissues of the breast is removed, and but you still have some part of your breast. Or mastectomy, where you have a complete removal of the breast, including the nipples and the areas around the breast area. And of course, breast reconstruction, which is done, is considered a breast implant can be used with your own tissue or for after your breast has been removed. And there is also maybe radiation therapy, where they use high powered energy rays to destroy the cancer cells. And it can be done using a machine or by implanting the radioactive material inside the tumor mass. So you start with medication, and based on the kind of cancer you have. And some of those medications can be able to help you so you don't have to progress. Or you start hormone therapy, lumpectomy, or mastectomy, depending on the kind of cancer, especially the radical ones. Just like I said, breast cancer is definitely not a death sentence.
Oh my gosh, thank you so much. And the chat, thank you to everybody who is here listening to benefit from this amazing wealth of knowledge that we're getting from our honorable one. Like, she is cream of the crop. So, Doctor, so thank you for being here and sharing this knowledge with the audience. So my next question for you would be, what are the treatment options? We've answered that, isn't it?
Yes.
Yeah. So tell us about that.
I just want to share with you that about maybe 500,000 women would die every year from breast cancer, and about 70% of those are from low-income and middle-income countries. And we do understand, because of poor health care and inability to access health. But I have a message, a take-home message for all of you, and including those watching. And I thank you all for taking your time. Take control of your own health and know the risk factors: family history, medical history, and personal history. Early detection is a cornerstone that will really continue to help us survive. So visit your doctor or your nurse practitioner for regular examination. My message is, if you're going to a doctor, take time. If you're going shopping, you take time to write your shopping list, isn't it? When you're going to your doctor or your nurse practitioner, take time to write down what your questions are. So when you go, it's easier to just open your little book or your little list to ask questions. Always get your reliable information from a trustworthy source. If you're going to be Dr. Google, go to the right website that has scientific knowledge. And also, please do not just take information out there. Get right resource, get the right information. Always, always trust. Go to your healthcare provider for information. And with this, my message is, let us fight cancer together. It's not a death sentence. Begin by checking yourself. TLC. Take your time to do that.
TLC.
Please ensure that you check and make sure that you always speak to a healthcare provider. Your health is your wealth. Thank you so much. And I hope to come back for more information regarding health and wellness, especially when it comes to women. One of the things I wanted to share with you, Chi, because I am an advocate for breastfeeding. And I wanted to use a few minutes to talk about the importance of breastfeeding because
Doctor,
yes?
I want to talk about something before you get to that. So,
okay.
Our doctor, she is an experienced conference speaker, just for your information. And she is passionate about women's health, breastfeeding, maternal and child well-being. So now, doctor, you can share all of this information with us.
Right. So it's important because when you hear about why do people talk about breastfeeding? Women that breastfeed have lower risk of breast cancer because the longer you breastfeed, the longer the estrogen is kept at bay. And then also the less likelihood that you're going to get breast cancer. So I'm going to take this message today, even though I'm talking about breast cancer, I want to also inject the importance of breastfeeding to encourage the young women that are having babies today to try their best to please breastfeed. It is important to understand that when you breastfeed, breastfeeding also has a lot of protective factors against breast cancer for the mother and including the benefits for the baby. So of course, we're talking about breast cancer awareness. Next time, I hope to be invited to talk about breastfeeding and the benefits of both the mother and the child. So therefore, my message continues to be your own advocate. Begin early checkup for breast cancer and ensure when you are in doubt, ask a medical provider.
Yes. Thank you so much, doctor. Really appreciate this. There's a question on the screen. Can you say it? We are enjoying the lecture. It's not this one. So
yes, I can see it. That's actually my dear brother, right from Nigeria.
Yes.
Thank you. I can see.
Yes.
We are not well informed on how we can get the
This
discharge in Africa. Definitely, I will ensure to help you to understand that. And there's so many informations about literatures that we really don't have in Africa because of poor health care, poor access to care. But there are great sources of health. Now everyone has access to the internet. I will encourage you to go to the CDC website, WHO website, American Cancer Society, to get a lot of information. And also, there are a lot of pictures that even shows how women can do their own tests, their own breast examination, including men, because breast cancer also happens to men. And but my message today is it's not a death sentence. So let's start early. Prevention is better than cure.
Yes. So she also asked how she can get this chart. I can answer that. For you to get this chart, Gab News, Ukah, for you to get this chart, I would encourage you because this channel is a healthy channel, and hopefully your Dr. Sister will be coming back to educate this audience, this community actually once in a while. So it will be best if you go to this channel, go to the channel, it's called UNMASCLifestyle. And then you have to watch a full video, and then you can subscribe to the channel and push the notification bell, and then you can watch this video all over as many times as you want. This video will be in that channel. So on Mass Lifestyle, you see the video and then you can watch it. So Doctor, continue. So I wanted to make sure that they can get access to this after today. As soon as this is done, by tomorrow, it will be, inshallah, by tonight or where, depending on where you are, you can get access to this video. But it's going to be on, you have to go to UNMASC Lifestyle to watch it.
Thank you so much, Chinwe. I just want to thank you for your time. I also want to thank you for the opportunity to bring me here to really talk about this important information and to encourage all the ladies out there, all our friends out there, all our family members out there to please do not take your health for granted. Remember, begin, TLC. Take your time, look, check, and also go to the doctor to make sure that you take your health into your own hands. Don't forget your monthly breast self-exam. And for those that are older or women that do not have their period anymore, you can choose whatever time that you can do your own breast exam. For younger women, day 10 after your first menstrual period, and make it a routine. When you are in doubt, you feel a lump, check it out. Go see a medical professional. Thank you so much. Oh, okay. Hi, Rasha. You are an intern. Okay, Rasha, listen, stop by my office tomorrow. And how can you visit the doctor's office if needed? Sorry. What is the difference between malignant breast cancer and benign? So, okay, I can answer that. Benign breast cancer is not cancerous. Those cancers stay. They do not move. They stay where they are in the breast. But malignant ones can leave the breast and go into the lymph node and metastasize to all other parts of the body, including the bone. So that's why it's important to, if you really discover breast cancer early, we can, there are a lot of treatments to really prevent the spread of the cancer due to what I have spoken to you about, maybe hormone therapy, chemotherapy, and also radiation therapy. And when in that, the doctor can always, when he has already moved on, the doctor can take the whole breast out, and that's when they go for mastectomy. And those people can also do what they call preventative, for if you have genetic tendencies, like if you have the BRCA1 and BRCA2, for people that have breast cancers in their family, they can decide to do mastectomy before the breast cancer even comes. And I hope I have answered your question.
Thank you.
Okay, between the married and unmarried, of course.
Yes.
Not married. It doesn't matter if you're married or not. But I think if you never had babies, or you're having a baby in an old age, there may be higher incidence of really getting breast cancer. For people that have had babies, they have the protective effect. A lot of, if you have babies, especially when you're young, you have the likelihood of being protected from breast cancer. And then older women also who, younger women, especially those that have babies and breastfeed for a longer time, may have a protective effect.
Wow. I love this. I love that we can share this with as many people that are willing to listen to it, because there's never an overload of information when it comes to things like this. And because this is the month of October, then we might as well just soak in and get information, and then, doctor, live with it for the entire year, until we come back to October. Because is this something we have to do in October and then wait for?
I can always say, no, we can do it anytime you want. No problem. Yes. I just want to answer the question from Rawan regarding what kind of infection. Of course, when you do a complete blood count, you are looking for white blood cells to see if you have a higher number of WBC, which is one of the markers of infection. So those are the kind of the blood, when they do blood count, it will be complete blood count, CBC, with differential to be able to give you information about infection. I hope that answers your question. Thank you, Sunita.
Thank you. I'm just checking to see if there are other questions in here. So give thumbs up to the live. If you're here, just, the thumbs up is good. We love it for just a like, just like the stream for us. Please, thank you. So I'm just going through, Doctor, to see if there are other questions that is in the chat before you wrap up. If you have any question, please, if you could put it in the chat so that we can make sure that, she gets any questions that we can deal with today. But otherwise, you can always go in and the comment will be off actually in this. So you're not going to be able to send any message into this. After this, you can only listen to this, but you cannot text into it. So this is the opportunity to ask your question, So if you have any question, ask so that the doctor can deal with it. I'm just checking. See, it's fine. Yeah, I'm just checking to make sure. Thank you so much for the information.
Thank you, Rasha.
I don't think there's any more questions. Thanks for the entertainment. Wow, thank you so much, Doctor. Really appreciate this. And so we're hoping that maybe you'll be coming back by November, end of November, to give us another session of the topic on healthy lifestyle. Yes. So if this is your first time coming to this channel, I would encourage you to go check out the website. It's UNMASCLifestyle. If you like what you see there, watch the entire video and you can connect with us by pushing the red button. And then when you push the red button, you have the opportunity to push the notification bell so that when we have any of this live chat coming, you will automatically, once we load it, it will come to your doorstep. So you get the opportunity to receive any of this. The doctor will be coming back here end of November. We don't have a date yet, but definitely for sure she's coming back to give us more information on how to self-care for ourselves. That's your word, doctor. So thank you so much for today. We really appreciate your wealth of knowledge and experience and the opportunity to share with us as we continue to build the community. Because like I said, she is just not a smart cracker. She also is passionate about things of, about humanity. So thank you so much, Doctor, once again, and hope to have you again in this channel.
Thank you so much, moderator and host of UNMASCLifestyle. Thank you for what you do. We appreciate it. Health is wealth. Thank you so much. And I'll be glad to come back anytime. Good night.
Thank you. And then, Doctor, tell the audience what to do.
Please subscribe, watch this video, get more information, and also love to see you continuously. Thank you so much. Bye-bye.
Thank you. Okay. Okay, so now doctor is, so if you have any question, I can wait for a little bit, you can text it, I'll send it to the doctor, and the next time we're going to meet, she can incorporate any question that you send to us into the next live stream that we're going to have. So you can email UNMASCLifestyle with your question. It is UNMASCLifestyle@gmail.com. But check out this. You can go back and rewind and watch this video as many times as you want if you need to get more information. So thank you all for coming. And this is the end of the live stream, except there's any question that we have to answer before we call it off. You're welcome. Chedozie, yeah, Fida, Chikeli Beauty. You know, it's amazing how we have all of the wonderful content creators, YouTubers in this channel as well. Chikeli Beauty is our skincare expert. So you can also connect. Chikeli Beauty is the name of the channel. So you can connect with her so that you would benefit on how to care for your skin. You know, we care for the inside, and it's very important as well that we package it properly. So Chikeli Beauty will be your person, your go-to channel for skincare, anything you need skincare. So thank you all. I have Valak here. Thank you for coming. Can food be used as medicine for breast cancer? The doctor is gone. Sorry, Valak. So this can be incorporated into the next time that the doctor is coming in November. I can take down this question for the doctor and she can answer some of these questions that we have coming now. But today the doctor is finished for today. So sorry about that, Valak. Thank you for coming. Really appreciate your presence here. So who else? What are the early signs of breast cancer? Yeah, Chidozie. So we can deal with all of this. Like I said, I'm going to make note of all of these questions and the doctor would incorporate. Just push your notification bell so that the next time we have the doctor coming, the information will come right to your door. So then you can, you know, set the alarm to remind you when it's going to start. Then you can engage. So thank you so much all for coming. Really appreciate it. So you can go back and watch the video as many times as you want, you know. And she has answered a lot of questions there if you missed out. Because what we did was a question and answer session. So she's answered a lot of questions maybe, but I don't think that one of those questions is there. What is the early signs? Yeah, Chiedozie, she answered this question. So go rewatch that video. We had symptoms, which are early signs, and then prevention and all of that. She answered all of those questions. So you can go and rewatch the video. And so thank you. So, yeah. So if you're just coming now, you can go and watch the video. The video will be up and running in a few hours, I think. I'm sure YouTube will make sure it's running soon. Yeah, Obodo. Yeah, many thanks, Sister Chinwe. Thank you so much for coming. Really appreciate all of you that have come here to support the stream and also to learn from our honorable Dr. Jacinta Ogbona. Yeah, thank you, Inese. Thank you so much for coming. Chikeli Beauty, you are just my first person. Thank you so much for all you do with skincare and all the help you do give to the community as well. Yeah, it's okay, Donny. If you're just coming, everything is gonna be loaded up soon. Maybe YouTube will make sure it's up and running in 2 hours or so. Then you can go back. It was a question and answer session. You can listen to it and watch it, rewind it as many times as you like. And the doctor is coming back here in November, towards the end of November. So if you want to subscribe to the channel, watch a full video, and then you can subscribe to the channel and then push the notification bell so that whenever she's coming or we have something special coming your way, we have a lot of things lined up that will be coming in this channel because it's a healthy living channel. So what we want to do is to make sure we share the awareness. Then you're equipped to go to your doctor and get your check and make sure that everything is intact. All we have to do is do our best, and then, the God Almighty has the rest to take care of it. But we have to start taking care of ourselves. So thank you all for coming. Host amazing. Thank you so much, Ikeli, for all you do for the community as well. Oh my gosh, James, you're here. Thank you so much. Can alcohol use? Yes, actually, the doctor talked about it. James, Dr. James, okay, I would suggest that you watch that video because she answered this question. She answered it. So if you watch the video, it's not long. It's like it's almost just less than 1 hour. So you can watch and listen and see all of the questions that she answered. Your question is part of the one that she answered. So I have, thank you so much, Dr. James Aruke, for supporting the stream and for coming to this. Yes, the doctor said that alcohol using is one of the, oh wow, Fatima, thank you for staying and answering some of your doctors, your director's questions. Really appreciate that. Thank you so much. Yeah, so I think that's it. We don't have any more questions for this day. So we're going to wrap up and just, set your notification bell so you can get the information come to your door. That will be the best way. And thank you all once again for coming. Really appreciate your support. So we'll call it off. I have somebody, this chat is, so I'll give 5 minutes. I'll close in 5 minutes now. 5 minutes, I'll be done. Just to make sure, because the chat is a bit slow. Yeah, thank you. Thank you. Thank you, Amira. Thank you so much for coming. Thanks a lot, wonderful host, for this great opportunity. Thank you, Chizube. Love you. Thank you so much for coming as well, for all your support. Really appreciate it. Thank you a lot. So that's it. And you all stay blessed. This is UNMASC Lifestyle. I always say this, and I have to say thank you so much for all of you wonderful, wonderful people that have supported this channel from the beginning to now. And as you all know, this channel was inspired by COVID. So we want to continue to do things that will keep us healthy in this channel. So if you have not given this live a thumbs up, this is the opportunity. You can like it now before we close. And thank you all once again for coming. Really appreciate your support. You have a blessed time, and you stay safe and stay blessed. Thank you all for coming. Bye now. Bye, everybody. Bye now. This channel, Chedozi, this channel has quite a few, but the next time I can put this question in the next, when the doctor comes back, she can answer some of this question. But I'm sure she would also encourage you to go to a dietitian. So, but yeah. Okay. So we're calling it off now. Thank you all, everybody, for coming, and you all stay safe.